Dr. Shweta Patel with Gaya Wellness, and today's topic for our live is what is an ectopic pregnancy and what every woman needs to know about it. An ectopic pregnancy is a pregnancy that actually gets stuck inside a woman's fallopian tube. So normally fertilization actually happens inside the fallopian tube, and then the fertilized embryo actually travels into the uterus where it finds itself a cute little spot, snuggles in, and then that's where all the implantation happens and growth happens and the baby actually starts to grow in the uterus. But that critical part of it doesn't even begin until that embryo is fertilized in the fallopian tubes and then makes that little journey into the uterus. That journey can actually be pretty treacherous if you were to look at the anatomy of the fallopian tube. It's not just a straightforward tunnel, it's actually almost like a maze, even though it looks like a tunnel. And so it's one more challenge for the entire concept of pregnancy, where when a sperm finally is able to make it through that maze to the egg and fertilize the fertilized egg then has to also make it out of that maze into the uterus. And miraculously, it happens all the time without any hiccup. However, in the event that that embryo or the fertilized egg actually becomes stuck in the fallopian tube and implants there, that's no bueno, because that basically is, number one, not a large enough environment for a pregnancy to continue to grow, so it's automatically going to compromise itself. Number two, it's not safe for the mom, because as the pregnancy continues to grow, it's kind of like a pressurized tube that's going to explode if not dealt with. So from the moment that ectopic pregnancy is diagnosed, us as obstetrician gynecologists no longer can view that as a viable pregnancy because of the risk it poses to the mom. It is essentially an impending life-threatening situation. And I can't tell you the number of times that I have been in a hospital on call and a woman has come in through the emergency room with sharp sudden pain and didn't even know she was pregnant. And the first time that it was diagnosed was when she was evaluated in the emergency room, and it was an actual ectopic pregnancy. So going from what it is, how does it happen? Typically, things that can create more traffic in the fallopian tube are the reasons that can increase your chances of having an ectopic pregnancy. They can happen on their own too, but there are things that increase risk factors. So the number one would be inflammation. Inflammation is basically where, if you think about a scar or a cut on your finger, that initial cut is very clean and the tissue looks very clean and sharp, but then as it's healing, it starts to swell and become red and hot, and that's your body's way of dealing with the trauma. And the aftermath of that trauma is inflammation. It's basically a sign that some kind of injury had occurred. So inflammation is what causes the trauma in the fallopian tube. Now, why does inflammation happen? Sometimes it can happen without any triggering cause that we could at least identify. Most often, though, it happens because of either any kind of sexually transmitted infection or infection of the fallopian tube, or it can happen from something along the lines of endometriosis, or if you've had any previous surgery on the fallopian tube, and that causes, again, healing and scar tissue to develop inside. But the most common reasons typically are infection causing inflammation, endometriosis, where you have abnormal or menstrual type cells that are they've implanted outside the uterus and sometimes often in the fallopian tube, and then they cause that inflammatory reaction inside. And lastly, any kind of direct injury from like surgery. And how does it typically present? Well, ectopic pregnancies can actually be very silent up until 6 to 7 weeks. What I mean by silent is a woman may not even have any symptoms, and it gets diagnosed incidentally because she has a positive pregnancy test and we are following her progress and it's not happening the way we would expect it to. What do I mean by that? So typically when a pregnancy is in the right location, it grows exponentially. Every day it's almost nearly doubling. Every 1 to 2 days it's nearly doubling in size. And it's hormonally speaking. And so we can actually trace that using your blood levels of your pregnancy hormone, HCG. And so if we detect that your hormone levels are not going up in a minimally increased fashion, at least 50 to 55%. Normally we're expecting it to double every 48 hours. But if that's not happening, then it starts to tip us off that maybe this pregnancy isn't able to make it out of the fallopian tube, and the constriction on its growth is what's causing the hormone levels to not increase. So that's number one, which is no signs at all. It's just not progressing like a normal pregnancy. Number two, no pain, but spotting or bleeding. And that's a very vague and very non-specific symptom because of how many of you may have had a pregnancy and you had implantation bleeding. And so we don't want to get alarmed from the first sight of any kind of spotting that you may experience. But if you are having spotting, or if you are having bleeding and you are aware that you're pregnant, or even if you're not, it might be something you need to bring up to your doctors to discuss what you should do. And as long as you're not having pain, not feeling lightheaded or dizzy, not feeling like you're going to pass out, in other words, what we call stable, it's okay to bring it up to your doctor at your, as soon as you can, so that we can do the right tests and assessments to figure out, hey, is this something that could be an ectopic pregnancy? Then there's the more theatrical, dramatic sign, which is you come in with excruciating pain and you're having some spotting, but not really heavy bleeding, because this is not like a miscarriage where the pregnancy is coming out because it's not quite in the uterus yet. It's actually spotting because that fallopian tube is sort of really being tested and being stretched, and that's creating a little bit of bleeding. But the predominant reason why you're having pain is because the fallopian tube is slowly tearing. And if it does tear open, that is an open wound inside your abdomen where you could be bleeding from. And the most common way I've seen patients present is where they already have blood in their belly and they're having a lot of pain, not just from the actual ruptured fallopian tube, but they're having pain from the blood in their abdomen. It's causing pressure, it's causing pain, it's causing irritation, and that's what brought them in. And otherwise, they would have been none the wiser that something like this is going on. So if that happens, obviously, you definitely, 911, ambulance, come to the emergency room, let your doctor know whatever needs to be done, but you need to seek urgent medical care. And then from that point on, typically we would do your blood test to see if you're stable. We would want to start with blood work to see what your hormone levels are doing, an ultrasound to see if we can actually detect the pregnancy in the uterus, as opposed to we can't see it in the uterus, but we can't see it in the fallopian tube either because it's very small. Ultimately, once we have that information, if you are stable, then we can treat you using a medication called methotrexate. It's actually a chemotherapy drug, and the way it works is it essentially stunts the growth of the pregnancy by taking away a very important nutrient, something that we always tell you to use your prenatal vitamins for, which is folic acid. So without that nutrient, the pregnancy is stunted in its growth. And essentially 85 to 90% of the time, this is a very effective medication. You usually only need 1 or 2 doses. It's a shot. It's given to you by the doctor or the emergency room facility. It's not something you go to the pharmacy, pick up and do yourself. And it has to be monitored very, very meticulously so we make sure that it's working. We know it is by your hormone levels dropping, and we do that by having you come in for some frequent blood tests. That's really only going to work if, number 1, you are stable, and number 2, the pregnancy is not very big, because if it is big, or if the fallopian tube has already been compromised, it's not going to be smart or prudent to wait for this medication to work over the course of several days. And in that scenario, you would most likely need either urgent surgery or emergent surgery. In other words, we're not waiting for things to get worse. If we detect that it's too big to be treated with medication, we're getting you set up for a surgery. And ideally, by doing that as soon as possible, we're avoiding the potential that you end up needing to have emergency surgery because we missed the boat and the tube already burst. So the 2 treatments of it are, number 1, we give you medication, or number two, we treat it surgically. And by treating it surgically, there are two approaches. It can be actually just where the fallopian tube is cut open and the pregnancy is evacuated out, and then we leave the fallopian tube as is. Or what I personally think is the more optimal approach is to actually remove the entire fallopian tube. And this can cause a little bit of, conflict in terms of what might be the right answer for other physicians. But I personally think that if this fallopian tube has demonstrated that it's inflamed and has a difficulty with having even one pregnancy go through, then now after having another injury, which is the ectopic itself, there is that much more of a risk in the future that if you have that fallopian tube still, that you're going to have another ectopic pregnancy. And we may not be as lucky this time in terms of detecting it early enough where we're able to surgically fix it. And that's why I'm a proponent of actually removing the entire fallopian tube. And this can be a decision, this has to be a decision that's made collectively between you and the physician, because obviously your fertility goals are going to be challenged if you only have one fallopian tube, or worse, if this is not your first time having an ectopic pregnancy and you've already had a fallopian tube removed and you end up having one on the other side. Again, it can happen because whatever caused the injury on one side could potentially have also been a cause of injury on the other side, and it just hasn't happened yet. So, can we leave them alone? Absolutely, especially if it's a very, very early stage pregnancy. Usually when I opt to just watch, that's when the hormone level is really under 200, ideally under 100. And there are times, just like when a normal pregnancy fails on its own, that a pregnancy even in the tube can fail on its own. And if we just wait and watch, and as long as it's not growing, and as long as you're doing okay, we can potentially get lucky and get away without having to do anything, and it just resolves itself. But most of the time, it involves some kind of intervention. And I got a question, thank you for watching, Chevy. One of the questions presented on the live is that, can it ever be viable? And the answer is no, because a viable pregnancy is really, and again, this can get into the weeds about the debate of what is considered viable. From the obstetrician standpoint, a pregnancy is considered viable after 24 weeks, because that is when a baby, if needed to be removed from the uterus for various reasons, has a reasonable chance of surviving on its own lungs. And before that, we haven't come up with the technology yet or the science yet. I'm sure it's underway, but as of now, our guidelines say that anything before that is not likely for the baby to survive because of its respiratory immaturity. And so when we're talking about a pregnancy that's 24 weeks, that is essentially the size of a small pineapple. Your fallopian tube is not able to house something that big without tearing. It can't probably house something bigger than a walnut. And even then it's likely to tear open. And if it tears open and there's bleeding, that is a direct threat to your livelihood. And so that is why as soon as we call it an ectopic pregnancy, the presumption is that our goal is to make sure that there's the well-being is, the primary focus of well-being is now on mom, because this pregnancy is not something we have come up with a way yet to save. So to recap, ectopic pregnancy just means pregnancy outside the uterus, or ectopic. It can happen most often because of infection, inflammation, previous history of surgery, previous history of an ectopic pregnancy, or even sometimes endometriosis, which can lead to inflammation of the fallopian tube. It can present with no symptoms at all, to spotting and painless bleeding, to pain that's intermittent, to heavy excruciating pain. Heavy bleeding is typically not a sign that we associate with an ectopic pregnancy. Nevertheless, don't worry about it. Let us figure that out for you. How do we fix it? There's usually, in the rare scenarios, just watching until it resolves itself, as in it aborts itself, or we give you medication that is a chemotherapy medication that helps the pregnancy stunt its growth and it no longer continues to grow, and then again it will resolve itself, or we have to surgically remove the pregnancy and or that fallopian tube. And the best way to make sure that you are not at risk is really when you are trying for pregnancy, keeping your doctor in the loop, and when you are finally pregnant, keeping your doctor in the loop, and then making sure you aren't having any signs or symptoms, and getting in to get prenatal care as early as it's recommended, so that if there's anything that's not above board, we can be quick to identify it. All right, guys, thank you so much for tuning in. Thank you all for the questions, and I'm very excited for some updates next week for Gaya Wellness. Our telehealth platform is underway, and we're going to be launching it hopefully mid-May. And the first 2 weeks, I am going to be offering free telehealth so that I can answer any questions that you guys may have had that may have been delayed in the process of me kind of going off on my own and starting this whole project, as a way of saying thank you, and also as a way of encouraging women to get their care addressed and not have costs be prohibitive for it. And then subsequently, more to come. So thank you again, everyone. Have a wonderful weekend. The next live will be next Tuesday.